Welcome to the Geisinger Health Plan Behavioral Health Provider Orientation. During this presentation, we will review the following: how Geisinger Health Plan communicates with our providers, what products we offer to our members, what behavioral health services require prior authorization, how to work with our case management team, resources available through pharmacy, how we measure quality, information regarding claim submission and payment, and how to keep your practice information current. As a participating provider, GHP has several ways to communicate with you, and we encourage you to use these resources. GHP provides unsecured information on our website, geisingerhealthplan.com. Secured member information and important provider resources are available through our provider portal, navinet.net. Navinet will be your primary resource for information and notification. Some items found on Navinet are your provider guide, the monthly update, bulletins, who to call, forms, member workflows. We also have a dedicated behavioral health provider care team. GHP offers a variety of products to our member population. We administer behavioral health benefits for commercial and marketplace programs, Medicare Advantage plans called Geisinger Gold, CHIP plan called GHP Kids, and TPA employer groups in need of custom self-funded plans. In order to determine your participation in each of these product lines, you may verify your status the following ways. Refer to Attachment B of your contract with the Geisinger Health Plan, or search your name or group to see which plans you accept. Geisinger Health Plan has other products but does not administer behavioral health benefits for PEBTF active state employees, GHP Family, our Medicaid program, Life Geisinger, and our Medicare supplement. Geisinger Health Plan requires prior authorization for the following behavioral health services: inpatient, residential, partial hospitalization, intensive outpatient treatment, testing, outpatient ECT, TMS, and ABA. For a full listing of services requiring prior authorization, please see our prior authorization list on Navinet. When requesting prior authorization, it is the ordering or admitting provider's responsibility. You may call to request prior authorization, or you may submit directly to Geisinger Health Plan by using our standard prior authorization form. Forms are available on Navinet under Behavioral Health. Electronic online submission through this same portal will be available to providers soon. Initiation of a request is required no less than 2 days prior to the service being rendered. For urgent or emergent admissions, the facility must notify GHP of the admission within 1 business day. Each admission will be followed for continued coverage during concurrent review. Notification regarding your request will be provided by our medical management staff. Approved services may be viewed on Navinet under the Authorization Inquiry workflow. If a denial is issued, you will be notified of your option to speak with a medical director regarding this decision. Geisinger Health Plan has created a care management team to work with you and your GHP patients. We offer a comprehensive population management, including behavioral health case management. Within that team, we have case managers, addiction coordinators, bachelor caseworkers, peer support specialists, and certified recovery specialists. This approach allows for collaboration between the member, primary care provider, and specialists to assist members with chronic conditions. Our behavioral health case management team has an expanded clinical role. Each case manager delivers and coordinates healthcare services, develops care plans, facilitates transitions of care, evaluates options and services to optimize health status, links individuals with behavioral health resources and providers, and collaborates with these resources. For prescriptions, a formulary lookup tool is available on Navinet. For prescriptions requiring prior authorization or exception, you may submit requests online through PromptPA, complete the pharmacy prior authorization form, or contact the Geisinger Health Plan Pharmacy Department by phone. Certain prescription and injectable drugs are covered only through the Specialty Pharmacy Vendor Program. You can find a complete list of these drugs through our vendor, MedImpact Direct Specialty, the GHP Pharmacy Department, or Navinet. Some of the behavioral health specific drugs which are included in the Specialty Vendor Program are listed below. To prescribe drugs through the Specialty Pharmacy Vendor Program, you may either e-scribe to one of the contracted specialty pharmacies through MedImpact Direct, or complete the MedImpact Direct Specialty Referral Form. HEDIS, or the Healthcare Effectiveness Data and Information Set, is a set of standardized performance measures developed by NCQA which allows direct, objective comparison of quality across health plans. It allows for standardized measurement, standardized reporting, and accurate, objective side-by-side comparisons. GHP uses HEDIS to measure provider performance. The following HEDIS measures are specific to behavioral health providers: antidepressant medication management, follow-up care for children prescribed ADHD medications, initiation and engagement of alcohol and other drug dependence treatment, adherence to antipsychotic medications for individuals with schizophrenia, metabolic monitoring for children and adolescents on antipsychotics, follow-up after hospitalization for mental illness. GHP has created a comprehensive HEDIS information guide which includes descriptions, coding, charting, and exclusions for these and other measures. This guide is posted on Navinet and is a valuable resource for providers. Claims to Geisinger Health Plan should be submitted through our electronic data interchange. You will work with your vendor to submit claims through one of our approved clearinghouses. For payment and remittance advice, providers are to register with Instamed. Payments through Instamed will be directly deposited, and EOPs will be available online through this portal. GHP does not issue paper checks. Information regarding these e-transactions can be found on our website, geisingerhealthplan.com. For claim submission to Geisinger Health Plan, providers are to use standard CMS 1500 or UB04 formats. Claim submission is preferred electronically. All fields and data elements are required. A current listing of this information, including electronic formatting, can be found under Claims and e-Transactions. If you are unable to submit electronically, paper claims may be used and all data element fields must be included. NPI numbers at the individual, facility, and organizational level are always required. If you will be seeing members in the CHIP program, additional actions are required by the state. Provider enrollment with the Department of Human Services at each service location is required for payment. Upon enrollment, DHS issues a Promise ID number. Your rendering provider NPI must be included on all claims so that GHP will crosswalk it to your Promise ID. Additionally, all ordering, referring, and prescribing provider NPIs must be listed on your claim. Timely filing for claims. Geisinger Health Plan requires that all claims be received within 120 days of the date of service. Any resubmission to add or correct data must be received within 60 days from the date of the initial EOP. Should you wish to appeal a claim, appeals may be submitted electronically through Navinet or by using our claim reconsideration form, also on Navinet. Appeal requests must be received within 60 days from the date on the EOP. Your practice information is important. Keeping your practice information current allows us to best serve our members and ensure you receive important communications. You may use our provider search feature to view your current information. If you need to make any changes to your office, add or remove a practitioner, or make other changes to your profile, you may submit those using the Practice Information Change form. Finally, we are asking all behavioral health providers to complete our service sheet to let our members know your clinical areas of focus. Thank you for being a participating provider with the Geisinger Health Plan. Here are a few things you can do to prepare for your Geisinger Health Plan patients. For online provider services, register your practice with Navinet. If you're already registered, request to add a health plan to your account. To prepare for billing and claims, work with your vendor or clearinghouse to submit through EDI. To begin receiving payments, register your practice with Instamed. Be sure to provide all the necessary information to receive direct deposits. You may contact our provider customer care team for behavioral health. And finally, let us know what types of services you provide. Complete our Geisinger Health Plan service sheet. Thank you.